I'm very pleased to be able to provide this video message of support for the new charter for our staff and associate specialist doctors and dentists in Wales. I'm sorry that I can't be there myself. However, I am committed to working with you to make Wales a place where all doctors, especially SAS doctors, feel welcomed and respected. I was proud to launch the charter on the 9th of August this year at the Keir Hardie University Health Park in Merthyr Tydfil. I hope that you agree that publishing this charter is an important step forward for SAS doctors here in Wales. At the last conference, you heard how the idea of a charter grew following the results of a Wales-wide listening exercise. After that exercise was undertaken by our Deputy Chief Medical Officer, Professor Chris Jones, and Dr. Raj Narula. I want to thank Dr. Narula and the other members of the SAS reference group who used the feedback from this exercise to create a charter that works for all parties. This charter is the culmination of 2 years of hard work between BMA Cymru Wales, the Wales Deanery, the Welsh Government and NHS employers. This reinforces the message that the Welsh Government is committed to working in partnership with staff groups and the service. We all have common objectives, achieving the best experience for our staff and patients and achieving the best outcomes. We firmly believe that working together is the best way to achieve those common objectives. The listening exercise highlighted some worrying issues across the country. It is not acceptable for staff to feel bullied or harassed. Bullying has to be eradicated from the workplace in every part of our National Health Service. I want to be absolutely clear that SAS doctors and dentists form an integral part of the NHS Wales workforce and must be treated with the respect and dignity that they deserve. In the past, SAS doctors have explained that they felt the level of professional support available to help them develop their careers was not what it should be. Doctors were feeling pressured to cover rotas during the SPA time of other doctors while not being offered the appropriate time and reciprocal arrangements for their own development. One of the key aims of the Charter is to ensure that support is made available to you and to stop staff feeling that they're at the back of the queue when it comes to training time budgets. You deserve credit and recognition for your workload, and this Charter should ensure that all parties work together to achieve this aim. There is a lot of activity in Wales at the moment focusing on staff. Our prudent healthcare agenda positively questions whether we have the right staff in the right role to make the best use of their skills, and we're working to ensure that all staff adhere to the values and principles of the NHS here in Wales. You should all have received a leaflet recently highlighting the core principles for the NHS Wales. These principles have been worked through in partnership with staff representatives and trade unions. They emphasise the value organisations place on every staff member and the crucial role you all play in running a successful NHS here in Wales. I hope your conference is an enjoyable one, and I do look forward to working together in the future. We want a workforce of SAS doctors who are proud to work in Wales, who can advance their professional development and who want to work together to continue to improve working life for SAS doctors here in Wales and of course outcomes for patients. Thank you for your time this morning.